Good morning, ladies and gentlemen. Welcome to the Faculty of Medicine breakfast webinar this morning. October is a month of filling with color of pink. It is a month that for all of us to remember and increase awareness in breast cancer. This year, we from Breast Surgery Unit, Department of Surgery, Faculty of Medicine, University Malaya, has a plan of series of activity to increase our awareness on breast cancer. We have launched the Pink October 2022 campaign on 3rd of October with the theme, Run for Hope, Run Against Breast Cancer. With this campaign, we have roadshow and booth for a week in our Plaza UMMC and multiple sessions of online and physical talk. Our October event will have the highlight on 29 October 2022 with the largest event of Neon Run, Ming Hing Bifrost Run 2022 in Stadium Arena, University Malaya. This year, we are aimed to raise the fund for B40 Group Diagnostic Fund for our public and our patient. As what we know, the use of advanced technique in early diagnosis of breast cancer has become our aim. Early detection, save lives. With the aim of improving diagnosis early, let's go back to our basic of breast cancer detection today. And today we have our distinguished first speaker, who's also my mentor, Professor Emeritus Dr. Kuan, who's our renowned professor from University Malaya, Faculty of Medicine. He's a medical physics pioneer whose research in radiation medicine has contributed significantly to the fight against breast cancer globally by researching in various imaging methods include breast density measurement to help early detection. His extensive research on breast cancer imaging also won the prestigious Maria Sklodowska-Curie Award in 2017, and as well as one of the world top 50 scientists and the latest 2020 Merdeka Award. On top of that, he has published more than 163 articles, H-index of 26, and books and chapters. With this, I would like to invite Professor Emeritus Kuan to give us the first talk today on updates of imaging in diagnosing breast diseases. Professor Ng.
Thank you very much, Prof. C, for the introduction. Selamat pagi, good morning. First, I'd like to thank the Department of Surgery for inviting me to give this talk to kick off this Pink October. I'll be sharing with you an update of breast imaging for the diagnosis of breast diseases. Well, most of us will know Olivia Newton-John. She passed away recently, August 8th, 2 months ago, age 73. She has such a beautiful, lovely voice. And most important thing, she was the 3-time cancer survivor. She battled against cancer 3 times. Very brave and of a positive attitude in life. And notice in what she said that about life, about the important things in life, and taught me to not sweat the small stuff. Look at the more important things in the life. slow down to ponder the meaning of life. And this is the message I hope that could impart to you at the end of this talk. Early detection saves life. Just a brief declaration of non-disclosure. It's good to realize that some statistics about breast cancer, just briefly going through that. This is from the Global Scan WHO 2020. Just indicate that it is one of the top killers, causes of death among women, and so on. So, interesting to note about this is the 8 standardized rate of breast cancers incidents. Mostly the top are the Western European countries, and about 100 per 100,000. Malaysia is still relatively low, about 37, but we are catching up nonetheless. And this is a very important diagram just to show you about early detection of breast cancer save life. So at the beginning, it's a few cluster of cells. It's non-palpable. You don't feel any pain or clump, and the cells multiply, become bigger and bigger, right? And eventually it spreads to other parts of the body. So that is invasive. Right? So you notice if it can catch it as early as possible, right? Then detect and diagnose, you have extremely good prognosis. So the aim is try to develop new imaging techniques to detect early breast disease, especially breast cancer. You look at this anatomical diagram of the breast is quite a complex organ or gland. So what is the abnormality there, right? Where is it located? And what's its nature? Its size, whether is it just a normal or a malignant? And what's the outlook? Will it become worse? Can it be removed? Can it be treated? Will it spread later on? These are the questions that medical doctors and scientists are still doing research on. So basically, the breast composition is important. The breast contains main 2 components, the fibroglandular tissue, these are the ducts, the lobules, and the connective tissues, as well as edible tissue, these are the fat. We hear this word a lot, a dense breast, but essentially it's one that has a higher proportion of the fibroglandular tissue. Okay? And on the right, it just show a mammogram of a dense breast. Now, this is a diagnostic challenge because we are trying to locate the tumor or the lesion is hidden by the dense part of the breast, so called masking effect. And often, some of those lesions will be missed. They just escape. There are ideal breast imaging techniques. Non-invasive. We don't have to cut open or poke it. We want close to 100% accurate diagnosis. You want to predict the outcome of the therapy, chemo or surgery and others. We also want to have no or minimum radiation, if all possible, and minimum discomfort for the lady. So this is ideal that we are still trying to develop. Until today, there are several breast imaging techniques. Mammography, ultrasound, magnetic resonance imaging or MRI, and SPECT and PET. This is the nuclear medicine techniques. And then recently there innovation such as the breast CT. So I'll take you through those very briefly, just to update you and highlight some of the recent advances. The mammography is a gold standard today. It is still one that most women, say above age 40 or 45, would have done one mammogram before. And in many clinical trials, it's proven to reduce mortality by something 30%, right? Women between age 50 to 69, and even up to 18% younger age group for 40 to 50 years. And it is the method of choice, right, in the current practice of diagnosis of breast cancers, those women with symptoms. But mammography is imperfect. It's still not ideal that we desire. Why? The sensitivity, meaning it's a positive when it turns out to be a positive, right? It is a cancer. It's as low as 40% in dense breast, right? Compared to 90% in fatty breast. Remember, to the dense part, the fibroglandular tissue, it is where the lesions or the tumors are sort of hidden, right? We can't detect. It's there, but mammography fails to detect or locate it. So this is the masking risk. That's why we develop other techniques as well. I'm showing some of the early historical photos of the positioning. It's different from today. And importantly, you mentioned about mammo, people think of the rather uncomfortable compression, a bit of painful. The technique is still much the same through the last few decades. And even today, we still need compression. We have a plate to compress the breast so that before X-ray is given. We look at the historical is interesting, how scientists have been working on improving the compression technique. And it's typical, ranging from on the left, the fatty breast, to a bit more heterogeneous to a very dense breast. And this is where the radiologist will look at the mammogram, also based on the patient history, symptoms, to make a diagnosis whether it is a normal, a benign, or malignant. And with the advent of digital mammography, there are a lot of innovations. One of them is called digital breast tomosynthesis, DBT, and the others like contrast enhanced digital mammography, where you introduce a contrast agent. And then the other one is a dual energy contrast enhanced digital subtraction mammography using several techniques, two different energy of X-ray, you do subtraction, image subtraction, and also contrast with advanced technique. The DBT is something which is gaining ground. Imagine the breast is three-dimensional object. A mammogram is two-dimensional. You compress it. So we have a lot of things being overlapped. So this superimposition, somehow you see that the lesion is there. It could be missed if overlap. So the whole idea of the tomosynthesis, tomo means slice in Greek. Want to slice it just like CT scan, to tomography. So this is where the X-ray tube will just rotate, or the breast tube being compressed and fixed, and try to take several images and reconstruct to a three-dimensional. So we have three-dimensional information from that. So you can see from the animation, right, the scan over, and then this is one of the models. You can see, right, this is the early from the, not a conventional mammogram, this is the tomographic. So this is a new frontier where we have improved the visualization. We try to locate. So these are some examples to show how the on the left is a 2D, the conventional mammogram, and the right is a tomosynthesis slides. So avoid all this overlapping and so-called artifacts and that. And also something like seeing through the tissue to various slices and being reconstructed. Okay. More example, this is from contrast enhanced, where we introduce contrast agent. It's something like a dye, and then it reveals better and showing some of the vascular features of the breast lesion as well. So this is the dual energy contrast enhanced digital subtraction mammography. It's still fairly new. Several centers have equipped with this, and there are some very interesting good results from that. At the beginning, we have been active in my department and my group in breast imaging techniques. This is one of the early work we did with Australia in the early days when digital tomosynthesis started. So, interesting. We also try to bring mammography to the people in New York. On the right bottom, you see this is the magma, the truck, Magna, sorry, with this truck that brings the mammography machine to rural areas to benefit those people as well. This is in Australia. So it's common to bring that. We want to screen as many people, women as possible. Next modality or imaging technique is ultrasound, which is common. Sure, you have done ultrasound before, maybe of the liver or abdomen. Okay? It's useful because it doesn't use radiation, and particularly those with dense breasts, it's difficult to locate the lesion. So ultrasound comes in handy. So we call it an adjunct for the diagnostic mammography. You can use ultrasound to guide a biopsy. For example, you have a palpable mass. You can evaluate whether it's benign, malignant. Also, ultrasound is widely available, relatively inexpensive. However, the downside is very depending on the skill and experience of the radiographers or radiologists who is performing that. So you can see here the examples of how the appearance of malignant or benign lesions look on the ultrasound. And from that, we developed something called ultrasound elastography. Any changes in the lesion, one of them is leading to it's been stiff. Try to remember, let's say, right, you have experienced perhaps pressing chicken meat. When it is fresh, it is very lasting, right? Very firm. Whereas it is stale, no longer fresh, it loses stiffness. So these are the physiological and pathological changes. So the ultrasound elastography measures the stiffness of the tissue in vivo. Right? So, and we use something called the Young's modulus in the physics principles explain. The strain elastography is one example. The diagram here you can see this is a model, different colors, and we include a lesion there as an abnormality. So you press it, it's a spoon to press. So how it changes the stiffness of the distorting the various tissues, right? Above and below the tumor. So this is how we use this tissue stiffness as an indicator of any abnormality. So these are some examples from various commercial techniques. They have the strain elastography to indicate how is the stiffness is measured in kilopascal, for example. And there's another technique called acoustic radiation force impulse imaging, RF, where you send an impulse, just a short force generated from the ultrasound transducer, and then this like a push inside the tissue, and it generates the shear wave, and then we detect it to determine the stiffness of it. This is an example. You see the transducer on top, and just simulate how the sound comes in. Oh, wait, oh, sorry about this animation. Okay, now this is the transverse, the shear wave being generated when the incident sound wave interact with the lesion, right? Travel, and then we detect that, right? And to quantify it. So this is the so-called region of interest where we identify. This is where we want to find out how stiff is that particular suspicious lesion. Oh, I'm trying to get out of this. Okay, this is the results of that. Okay, so sorry about a bit hiccup in the animation, but you got an idea, right? So we have example when you color code it to help in visualization. So the red will be stiff and the blue will be soft. So in addition to just the conventional ultrasound, some equipment will be equipped with this elastography, with different techniques of it. So this is another example where this a color map, something like called a heat map. It just show, oh, that suspicious part is stiff, and the radiologist or surgeon will continue to investigate that part. Could be a biopsy or for MRI, for example. And because of the dependence of the operator skill, right, the ultrasound probe moving around different angle, so there's need to have an automated system. So we have this automated breast ultrasound, the abreast, to overcome this problem. It provides the three-dimensional representation of the breast, right, as much as possible. So this is the two different models of the automated breast ultrasound system. The equipment is interesting. So when you have a pretty large transducer, it's about size of the mammography compression plate, right? And then the next will show you the other transducer will move around the scan. So you don't need a human operator to do that. Okay. So on the right, you see you have the plate there, and the transducer just sweep across, and then you collect the ultrasound signal, and then reconstruct various images. Some look like a CT scan image. Some it's rather a new way to visualize the breast in 3 dimension. So in this way, it avoids any dependency on the operator and skill, and also is it relatively fast and reproducible. So this is a technique to look out for. It is still quite new. More about the elastography part of it. There's more illustration of that. Ultrasound after that is MRI, magnetic resonance imaging. And this is where we are using to detect the extent of the disease within the breast, particularly those with dense breast. So it could be a much more sensitive screening tool, particularly those with the dense breast or those with a higher cancer risk. So this technique required the injection of intravenous gadolinium. This is a contrast medium or agent. So we want to assess the permeability of the blood vessels supplying the tumor. So it's neogenesis means the growth of new blood vessels when the cancer cells are rapidly dividing, growing, So there are more blood vessels. So this is where it may cause leaking vessels, and this is there's an enhancement of the suspicious lesion if it's cancerous. So MRI is a very complex imaging technique. It's multi-parametric, meaning we have different techniques. For example, you have T1 weighted, T2 weighted. You have dynamic contrast enhanced, diffusion weighted imaging, apparent diffusion coefficient. These are very technical. Probably only the radiologists, they've been trained, they know how to do. So it is a, that's why MRI for breast takes quite a long time. And different types of imaging technique will give different information. So you could imagine this is an example of the protocol that is used in UMMC for breast MRI. There are different techniques. All will contribute to the complete information about the breast information. So it's useful, we talk about that. And these are examples, the appearance of the MR image of the breast. These are benign lesions. Then you have the malignant lesion. So you have T1, T2 weighted, plus contrast, plus and other parameters as we have learned earlier. So this is an example of occult primary cancer. It is not detectable from the ultrasound or mammogram, and comes for the MRI. It show that we found an abnormality from this mass there. So it is a useful adjunct tool, right? Though it is complex, it is expensive and takes a long time. It doesn't use radiation at all. Next would be the SPECT, and this is part of the so-called radionuclide or scintigraphy, radionuclide imaging or radionuclide scintigraphy. It uses radio label tracers, or we call it radiopharmaceuticals, to detect any metabolic activity of the breast tumor. And this SPECT stands for single photon emission computed tomography. So it's principle of CT. So where we use like technetium-99m is a common label with certain chemical products, and we detect the gamma ray given out by this after it's been uptake or localized in the abnormality. And the other one is PET, positron emission tomography. Here we use a positron emitter. They give out a positron. It's something quite new. A common one is called fluorine-18. So we heard of FDG, this fluorine-18, fluorodeoxyglucose. So it's a glucose. So basically, it is a radioactive sugar, right? Which is uptake by the tumor or any abnormality. So we used to detect that. And also it can be used to do like a bone scan, any metastasis. So these are example. This is from on the left A is the mammogram, and then this ultrasound, and then the bottom is the SPECT. These are so-called technetium-99m system, may be a very common technique we use to locate the uptake, the highly radioactive part. And sometimes it's also have the heat map, the color coded. And this is the PET, the FDG PET CT. We combine with a CT scan, also with a PET, and both give the anatomical and the functional information on that. Okay? So you combine these two together, and it is a very sensitive technique. So after just updating ourselves, some of these key techniques. So let's comparing what we have learned, right? The mammography, the ultrasound, PET, MRI. So each has its advantages and disadvantages. Just look at the sensitivity, right? The mammography, depending on the breast composition. So those are the younger, say around 40 years, tend to have a lower sensitivity, meaning lower pick up the positive, right? The cancer, okay? Because maybe dense breast amongst younger women is quite high specificity, meaning when it's negative, when there's no cancer, and the truth is there's no cancer, the specificity. Ultrasound is very high in sensitivity, and it's just moderate for specificity. For PET, it's high sensitively and moderate specificity. Now MR is very high sensitivity, but the specificity is low to moderate, right? Still a lot of improvement in the techniques. So that's why we need to have so many tools in that. Recently, we have this emerging tool. One of them is the breast CT. The principle of CT, where patient lies face down, prone position, and then below there's X-ray just scanning going around it and reconstruct the breast image. This doesn't require compression, and this is one of the commercial models from Conic approved by FDA. It revealed fantastic information, no compression. It also revealed the blood vessels, the vasculature, and also three-dimensional information undistorted. So this is a very promising tool in the future. And some have combined, right? We go hybrid. We have the SPECT, PET, and CT give us more information. So there are a lot of exciting development. And we have been involved heavily in the research in breast imaging. This is a book we published recently with Singapore colleagues. Now, the lastly, I have to show you that we all have gone for diagnosis, right? Screening. But how about prediction, prevention? These are important. Prediction. And prediction breast risk factor. There are various risk factors around, right? So we could like family history, reproductive factors, lifestyle, environment. And one of them is breast density, right? It's something that we have done quite a lot of research. Now, those who have dense breasts are shown to have a 4 to 6 times higher risk of developing breast cancer. Okay? Only the age or the BRCA1, BRCA2 mutations increase the risk further. So that is a topic of interest. So what we do is we look at the volume of the breast is dense, which is the fibroglandular part, divided by the overall volume of the breast. This gives us the information of what we call the breast density. And by quantitating it, we put it into the model to estimate, to predict the risk. And we have published 2 key important papers in that. One was in Lancet Oncology with Prof. Vip and Prof. Aisha, the 2 famous breast surgeons on that in the Lancet Oncology, and also another one in medical physics, Vision 2020 on this mammography breast density and its clinical applications. So we have seen the search for an ideal imaging techniques, and you can see there are so many different types of imaging techniques, but all complement one another. There's no one tool that will tell us everything that we want to know about the breast. So a lot of data will be contained from there. We generated the images. What do we do about that? Dr. Wong afterward will tell us how we handle those large data and the use of AI. So I'd like to leave you with this message. Let us keep abreast with breast health. Thank you.
Thank you, Professor Ng, for the insightful talk just now. So I would like to hand over my mic to my colleague, Dr. Teoh Ying, our breast surgeon, oncoplastic surgeon from UMMC. She will She will introduce Dr. Wong for the next talk. Thank you.